Well, with regards to renal cell carcinoma, I will share with you my perspective as a urologist. So what I see in my everyday practice are patients who come in generally with a diagnosis of renal cancer, having localized disease, although there are unfortunately patients who come in sometimes completely asymptomatic, and when they receive the first CT scan of the abdomen to see what's going on, and we find disease which is completely diffused, and the patient would be totally asymptomatic. So when starting from that position, the use of these drugs is important in two settings. When you take out a kidney or you remove partially a lesion from the kidney, and it comes out that the final pathology is very bad, with aggressive disease, perhaps unexpectedly one lymph node is positive. We know that the final prognosis for that patient is bad. And we would like to have results of studies suggesting that one drug, if administered, is going to improve the final prognosis of the patient. So this was not true until several months ago. There were studies done with different types of drugs, sunitinib specifically, that would suggest that perhaps there was a positive result, but studies were conflicting. Now at this meeting was presented again the results of a study which is suggesting that some of the patients can benefit. So it is a major advance, which means that once the surgical part of the treatment, which is always the first, has been done, if the patient is in dangerous conditions, he can be helped in that way. The second setting, which is something that is dealt specifically with by the medical oncologists, we are not seeing those, are patients who develop metastatic disease. There is a number of drugs that can be used, and now it came out that the use of drugs which are dealing with the immune system of the patient can give excellent results, specifically by combining two drugs on this line. There is a lot of emerging new data in this area, not only for kidney cancer, also for prostate cancer. So it's interesting to see that the panorama of medical treatment is expanding, and hopefully this will bring back new opportunities for our patients.